I know that when you were in Mozambique, you you were working with some women there as well, and that a lot of them were having some of those kind of modern type health problems, with the high blood sugar and things that a lot of people have nowadays, and that you were able to see some pretty significant improvements with some of the methods that you were using. Can you tell me just a little bit about kind of an overview of what that was like and what kind of interventions you were using there?
Absolutely. So there's been a lot of, I think, evolution in my methods, probably most like everyone else. But you're right that even in Mozambique, so this was back, 15, almost 20 years ago. I left Mozambique already close to 8 years ago. So, it's been a while. But even then, my practice was focused on weight loss mostly. And so that, of course, attracted mostly women. So it wasn't anything particular about my practice that attracted women. I think it was just the idea. And it's a funny story how I got to that, because my original intent was not to help people with weight loss. I was sort of put in
Mm-hmm.
that setting because when I went to Mozambique, I did want to work with women. Actually, I wanted to work with maternal fetal health. And I thought I was going to work in the countryside with women and babies. And that wasn't available to me in Mozambique at the time. The Minister of Health had a meeting with me and said that what he actually wanted me to do was to open up a weight loss clinic in the capital, in the city, which shocked me because I thought, who wants to lose weight in Mozambique? And it just so happened that a lot of people wanted to lose weight in Mozambique. And I learned, this is how I actually learned about metabolic syndrome and how the epidemic, I think, of obesity and diabetes, that it was, worldwide, including Mozambique. The funny thing is, at the time, Mozambique was considered the poorest country in the world, and the country with the highest rate of, I guess, famine. And in the city, we were seeing the polar opposite. So we had that dichotomy going on, right? You had people that were overweight, diabetic, looking to lose weight. And so that's where he asked me to open my clinic. And so I did. It was kind of like I didn't have a choice, to be totally honest, at the time. I was very much told what to do and where to do it. And that's what I did. I opened up a weight loss clinic. I had very little experience. In fact, I had zero experience in weight loss. So I had to learn. And so, most like everyone else, I used my naturopathic background and what I knew about nutrition to create real food diets. That's how I sort of started. It did start, I never really focused on low calorie, even though that was the conventional treatment and still is the conventional treatment for weight loss, low calorie. But that wasn't my focus. I ended up focusing exclusively on real food diets. And over time, it just so happened that I started going more and more towards low carb as I learned more and more. And eventually fasting started to become a part of my program. And then eventually I moved back to Toronto and started working with the fasting method because I had already started reading and learning more about Jason Fung and Megan Ramos. And I was very interested in what they were doing in Toronto, and I wanted to join them. And luckily I was able to join their clinic. So in Mozambique, having a weight loss clinic in the city, and it's a very Maputo, which is the city where I was born, is, it's a very, busy, fun, modern place. And it's got a lot of expats as well as a large, of course, local community. And so I had a lot of clients. I was very, very busy. I was the only person offering the service. So clearly I was busy and I had a line out the door. So I had a lot of opportunity to learn. People were very kind and patient, and they wanted to learn along with me because they had nobody else to help them unless they went to South Africa. And that's what people did before me. They went to South Africa to get dietary help. And my diet was significantly different than the diet that they were getting in South Africa, because in South Africa, they were doing hormone shots and they were taking supplements and they were doing very, very low calorie diets, whereas my diet was not low calorie. It was very much real food and eventually low carb based type of diets. What happened along that journey and how women come into play is that at some point we started to realize that whatever dietary approach we were implementing was having an impact on women's fertility. And that's where the interesting link happened in women's health.
Mm-hmm.
Why were women that had previously tried to get pregnant and were unsuccessful in getting pregnant, why were they all of a sudden getting pregnant? And it became, I developed a reputation for getting women pregnant, and that became a bit of a joke. And that's where the story began and how I started working on women's health.
Great. Thanks for that explanation. And we'll get into that last topic a little bit more later in the interview. But that's very interesting what you said about Mozambique in general. And for anyone who's listening who's not a geography buff, I think it's on the southeast coast of Africa, next to Madagascar, and next to South Africa, like you were saying.
It's on the north border of South Africa. So there's a big relationship between Mozambique and South Africa, even though South Africa is an English-speaking country and Mozambique is a Portuguese-speaking country. I mean, they're geographically right next to each other. So there's a huge influence back and forth.
Gotcha. Yeah. And you talked about how there was a kind of like a famine in the countryside, if you will, or in like a lot of the rural areas. But then in the city, it's kind of different. And so you have a little more affluence, a little more, the expats. So like people from other countries and just a little more wealth in general. And so it's kind of ironic if you're surrounded by famine that then there's people that are overweight there and struggling to lose weight. I think it kind of mirrors the diseases of affluence, which are so common nowadays, which are kind of all those things where a lot of processed food equals high blood sugar, and type 2 diabetes equals other things that are related to that, like heart disease and high blood pressure and PCOS. And so we'll get to PCOS in a minute, because I thought we should just kind of talk a little bit about women and fasting a little bit first, and then kind of get into that afterwards.